thank you. You spoke just long enough for me to get my notes in order. Had a rather busy day. I think my role is to say why I think inequality matters. I'm going to touch on what I think two subsequent speakers are going to say. Basically why I don't think it's enough to pull bottom incomes up, and why good public services can't offset all the effects of inequality, though they are important. Basically why inequality matters is that more unequal societies have more of almost every social problem. Whether you look at measures of cohesion, trust, social capital, lots of work, Putnam in the regions of Italy and the United States, but many other papers looking at trust in relation to inequality and other measures of social capital, show that social relations deteriorate in more unequal societies. It's very much, as I think that old intuition that inequality is divisive and socially corrosive suggests. Basically, the data says that is right. But on top of that, almost all the problems which have social gradients, the problems that are more common at the bottom of society, like poor health, like teenage births, like obesity, like measures of child well-being, drug abuse, mental illness, educational failure, social mobility, all those problems are worse in more unequal societies. In a way, our book is a theory of problems with social gradients. They're not simply due to sorting the population between the resilient and the vulnerable. None of that can explain why these problems are anything from 2 times to 10 times as common in societies with bigger income differences. Now, our critics take our book as the only evidence that inequality has any harmful effects at all. On health, there are over 200 papers in the academic journals, the journals that most people don't read ever, looking at inequality in relation to health in many different settings. There are 50 papers on violence and inequality in many different settings. As early as 1993, a review and meta-analysis said that that was a robust relationship, and there have been many more papers attesting to that relationship since then. But what we're looking at, if you like, is that it's a sort of social dysfunction related to inequality. It's not just 1 or 2 problems that get worse, it's most problems that get worse. These differences are so large, as I say, anything up to 10 times as common in more unequal countries, things like rates of imprisonment or homicides, when you look at, for instance, comparing both together American states and Canadian provinces, 10-fold differences in homicide rates related to inequality. But things like infant mortality or mental illness, only 2 or 3-fold differences, but still enormous. You know, I once worked in health promotion in Bristol. If we could have made a 10% reduction in any of those problems, we'd have been thrilled. And now we're looking at these huge differences related to inequality. People sometimes think that we've shown correlation but not causality. That's rubbish. There's a huge amount of evidence on the causal relationships leading through from social status to chronic stress to poorer health. You can see the same mechanisms in relation to mental illness. You can see the effects of people feeling looked down on and disrespected on homicide, and that homicide is most commonly triggered by people feeling disrespected, loss of face, humiliation. But some of these causal processes have been tested experimentally with non-human primates, which is possible to do because many of the stress responses, the biology of chronic stress is very similar in different mammalian species. So you can keep monkeys in the same compounds, the same material environment, and give them the same diet. You can manipulate social status by moving animals between groups. And you see that many of the effects of low social status under those conditions are very like what we see in the Whitehall studies of civil servants. I'm going to and the physiological effects in terms of levels of fibrinogen or blood clotting factors, coronary arteries flaring up and so on, much faster cholesterol levels, in ways that make good sense in terms of the evolution of responses to chronic stress. I want to say one or two things, though, about why you can't deal with these problems by simply levelling up. We show repeatedly in the book that these problems are independent of the level of GNP per capita in the rich countries. Rises in GNP per capita, economic growth, are really important in developing countries. But if you look in the rich developed countries, that relationship disappears. The curve of rising life expectancy flattens off in relation to GNP per capita. It also does if you look at child well-being. It also does if you look at our index of health and social problems, where we put together all the things I've mentioned. None of those seem to be related to GNP per capita. So raising the standard of living of the whole population doesn't seem to do any good to children, or to measures of the welfare of adults, or to any of these other things I've been talking about. Of course, for individuals, it's an advantage to move up in your society. You can improve your happiness, your well-being, measures like that, if you move up in your own society. But if we all move up together, it seems to be a zero-sum game. And I may say, when we looked at levels of ownership of consumer durables amongst the American poor, they have an absolute poverty line. About, when I looked, 12 or 13% of the American population were below the federal poverty line. 80% of them had some kind of air conditioning. Over a third of them had dishwashers. And yet they have more violence, more drug problems, more teenage births, more obesity, more mental illness. And so you can't believe that raising the material standards is what it's about. What we're looking at are the psychosocial effects of inequality, more to do with feelings of superiority and inferiority, the social differentiation processes. That's the real change in the understanding of the effects of inequality we need to make. You know, it was all right for Blair to think that maybe with modern living standards, inequality didn't matter anymore. Maybe it mattered in the 30s when people were in terrible overcrowded housing, in sanitary conditions, still some kids without shoes. Then it was wrong for other people to have huge wealth. But perhaps now in the modern world, when everyone has cars and central heating and DVDs and so on, perhaps it doesn't matter. It's the psychosocial effects that we're seeing. Nearly all the factors I look at are behavioral things, like teenage births, like drug abuse, like poor educational performance, like violence. And so they go through the mind. It's not what your damp housing does to you directly. That doesn't give you a teenage birth. I don't mean that we shouldn't do anything about damp housing. In terms of services, we do control for, well, first we don't need to control for medical care expenditure because we show there is no relationship, and this is well known in epidemiology, between medical care expenditure per head of population adjusted for local prices and death rates. It's really extraordinary that although medical care is really important in terms of the quality of life, you know, having your hernia done or your knees or hips or whatever, it is not a very powerful determinant of the length of life in our societies. So however good your medical care is, it actually just patches up what's gone wrong. Much more important than the treatment you get for your cancer or heart disease is whether and when you get it in the first place. And they're just huge differences. I mean, the Whitehall studies, when everyone was getting the same medical care, there were fourfold differences in heart disease death rates amongst Whitehall civil servants. So much more important than the medical care is what you're supposed to start with. We also control for government social expenditure per capita. And you see all these things. Nobody really believes that, I don't know, drug rehabilitation units make a major difference to the scale of drug problems in society, or, I don't know, any of our, well, even the experts on policing say that policing is not one of the major determinants of levels of crime. These are problems, we respond to high levels of these problems by demanding more services, but as fast as we remedy any of those problems amongst some individuals, they're recreated. I remember someone who did one of the biggest studies in the States trying to reduce risk factors for coronary heart disease amongst people identified as high risk of coronary heart disease, and he said, on the rare occasions we persuaded somebody not to smoke, we knew there was a child taking his first cigarette somewhere else in the same town. These problems are constantly recreated. The services are very partially effective and very expensive. They don't get to the root of the problem. We will need more and very expensive services as long as we have huge differences in income which are creating these problems. I'll stop there. Thank you.